Welcome to this video of our Facts Only series. Today we are going to discuss vitamin D. First, I have to say something. Vitamin D, when it was first discovered, it was named that way. It's actually a hormone. It doesn't act like a vitamin. It has a binding protein called vitamin D binding protein, and it has a receptor called vitamin D receptor. So we'll continue to call it vitamin D, but its actions are like any other hormone. We're going to very briefly discuss chemistry, function, dietary sources, deficiency, recommended daily intake, and finally therapeutic uses and toxicity. Let's spend a minute on this very important graph. The main source of vitamin D is not food, it's sun exposure. So ultraviolet B, UVB, from the sunlight interacts with the skin to produce 7-dehydrocholesterol. This is the first step towards making vitamin D. Now, you need direct casual sun exposure. So direct sun exposure to the skin for a few minutes a day is enough, but you cannot get vitamin D if you're, say, getting exposure to the sun through a window. It has to be direct exposure directly to the skin. The skin has to be exposed, okay? But you don't have to sit in the sun until you get skin cancer. Casual exposure for a few minutes a day is enough. Now, once you have this 7-dehydrocholesterol made in the skin, it's going to be converted into something called vitamin D3 or cholecalciferol. Now, if you are getting vitamin D from plant sources, you are going to get ergosterol or vitamin D2. So D3 is from the sun or animal sources, D2 is from plants. There isn't a huge difference between the two. Maybe D3 is a little bit better. Now, in either case, vitamin D2 or D3 will have to go to the liver for the first step of activation. The liver will add a group called hydroxy group at 25, at the 25 location, and vitamin D becomes 25 hydroxycalciferol. Okay, or 25-hydroxyvitamin D. Another name for it is calcidiol. So now this vitamin D is activated in the liver. Now this is not enough. This vitamin D will go to the kidney for the final activation, where another hydroxy group is added by an enzyme called 1-alpha hydroxylase. It's only made in the kidney. And then you have something called 1,25-dihydroxycholecalciferol or 1,25-dihydroxyvitamin D. And this vitamin D is called calcitriol, and it is the most active form of vitamin D. So let's summarize. We get vitamin D, the first step, from sun exposure. We can also get it from animal sources. It's called D3, or plant sources called D2. It goes to the liver for the first step of activation and then goes to the kidneys for the final step of activation. Now, everything I'm going to talk about really pertains to 25-hydroxyvitamin D. We're not going to talk about the kidney form of vitamin D or calcitriol or 1,25-dihydroxyvitamin D. This is of interest only if you're in the medical field, especially if you are a kidney doctor, a nephrologist like me. And if you like more information, in my channel, there are very detailed lectures on calcium, phosphorus, and all forms of vitamin D. I'm going to provide a link. My book also has 2 chapters, one on calcium, one on phosphorus. So we are going to discuss the 25-hydroxyvitamin D, okay, and some people call it the nutritional vitamin D. Now, what does vitamin D do? Well, it increases absorption of calcium and phosphorus from the intestine, and also it releases calcium from the bone. It helps in bone formation. You cannot form bone without vitamin D, and also it decreases excretion of calcium and phosphorus in the urine, meaning you are going to get more phosphorus and calcium through the intestine, and you're going to waste less calcium and phosphorus in the urine. Now, there are not that many dietary sources of vitamin D. Like I said, you get it from the sun. You can get it from certain LED lights, and I'm going to provide a link for a short video on that subject with a reference. You can get vitamin D from supplements, of course. You can get it from chestnut mushrooms. You can get it from fish with fatty liver, like salmon, and foods, at least in the United States, like fortified cereals and milk. They are fortified with vitamin D. So these are the sources other than direct sunlight, like we talked about. Vitamin D deficiency is very common, especially in a northern climate. If you don't have much sun in your city, in your country, then vitamin D deficiency is going to be very common. So first cause is lack of sun exposure. People with dark skin or darker skin, they're likelier to get vitamin D deficiency. People who are in a nursing home, in a hospital, who are elderly, who don't get out enough, may get vitamin D deficiency because of lack of sun exposure. Moreover, when the person is older, they make less vitamin D through their skin, even if they have adequate sun exposure. Malabsorption, because this is a fat soluble vitamin, bariatric surgery, any gastric bypass surgery, liver and kidney disease. We just said that you have to activate vitamin D in the liver and then in the kidney. So if you have liver or kidney disease or both, you're likely to have problems with vitamin D. Some medications like phenytoin, which is used for seizures, can cause vitamin D deficiency. And then there are hereditary disorders, very rare, like vitamin D dependent rickets, vitamin D resistant rickets. And again, I encourage you to watch my videos that I'm going to provide the link to if you like to get more information on these very rare conditions. Fortunately, we can easily determine if a person has vitamin D deficiency by doing a blood test. So we order 25-hydroxy vitamin D, and if the level is less than 20 nanogram per ml, then you have vitamin D deficiency. Actually, I would like to see the level 30 and above, but 20 is the bare minimum. Now, vitamin D deficiency, when it's really severe, it can cause rickets in children when they have really problems with their bones. Adults have osteomalacia because their bones cannot bend, that can cause severe bone disease, and this is only in severe deficiency. Now, like we said, vitamin D increases the absorption of calcium and phosphorus. So when it is low, you have low calcium and low phosphorus. In the hospital, when I see someone with low calcium and phosphorus, both, the first thing I check is vitamin D level. Vitamin D toxicity is seen in people who take a lot of supplements. You are not going to see it due to prolonged sun exposure. You can get skin cancer from that, but not vitamin D toxicity. When toxicity happens, you're going to get high calcium or hypercalcemia. So what does that mean? It's going to mean excessive thirst, urination, dehydration, kidney failure, kidney stones, etc. So it's therefore not recommended that you do take a lot of supplements. Recommended daily allowance 600 to 800 international units, which is equal to 15 to 20 micrograms per day. When we have low vitamin D level, and this is based again on a blood level, we replace, and the amount of replacement really depends on the level of deficiency. I may start with 50 micrograms or 2,000 international units and go from there. I really recommend that you do not take a large amount of vitamin D supplements without checking a level before knowing what's going on. If you would like to take, say, 25 microgram or 1,000 international units a day, probably you'll be fine. But more than that, I recommend checking a level. I'm going to end here. This is really a large subject. I struggle to finish it in under 10 minutes. Please watch my videos on the topic if you'd like more information.